A deep plane facelift is an increasingly popular procedure. Today, I'm going to give you insights into why you should consider having a deep plane facelift versus a mini lift or neck lift. For those who are new to my channel, I am Dr. Joel Kopelman. I'm a facial plastic surgeon, and I have many years of performing facelifts. I'm going to give you further details about deep plane facelifting and why it's a procedure of choice for certain types of patients. So let me describe for you some of the basic anatomic features of the face which are addressed at the time of doing a facelift. What we have is, obviously the skin is the outer shell of our face. Below that we have fat, and we have muscle and fascia, which is called the SMAS layer, and retaining ligaments over the masseter muscle and cervical region. We have to release these retaining ligaments in order to do a deep plane facelift. Why is that? Because they hold back and restrict the movement of the soft tissues upward. In a younger patient, that's fine, because most of the time just doing tightening out in this region before we get it into the retaining ligaments will adequately raise the face and give good definition along the jawline, as I've described in my prior videos on mini facelifting and neck lifting. But as we age, there's more sagging and more bulges, and we have to raise these tissues upward to a greater extent. So in those cases, what we need to do is release more areas of the face that are holding back the tissue movement, and those areas are specifically the retaining ligaments that I've described. The other thing I want to point out is that there are different degrees of neck laxity that I have to address, and accumulation of neck fat. Some people have very thick, heavy necks due to a lot of fat accumulation, or their muscles are very thick. In those patients, it is very important to dissect below the muscle layer, which is these two muscles that straddle the neck called the platysmal muscles. I go below the platysmal muscle and I remove fat below the platysmal muscle in order to get a more acute angle to the neckline here. So the profile is more of a 90-degree angle. I also want to get better definition along the jawline itself. I retain the fat below the skin in most cases in order to create a softened natural contour to the lower face. I don't want to create a hollowing and skeletonization of the face down here where it's too hollow and looks too surgical. As you can tell, this is a complicated procedure. It's not something for a beginner to do. I've had years of experience doing standard facelifts, and I've progressed into deep plane facelifts. And I've been doing it for over 20 years. You have to seek out a surgeon who has extensive knowledge of the facial anatomy, how to do the procedure in a safe and consistent way, and that's who you need to seek out in terms of finding the right person to do this procedure. You gotta go to somebody with experience. Now, who is the ideal candidate for a deep plane facelift? There are those surgeons out there who believe that everybody is a candidate for deep plane facelift, no matter what your age. I do not advocate deep plane facelifts for everybody. I think that a mini SMAS lift is perfectly good for many, many patients who come in who are in a younger age group. But as we age, there are age-related changes that occur that necessitate a greater release of facial structures in order to mobilize them and reposition them, where they were anatomically when they were younger. And that's what makes a deep plane facelift a great option for those people who are in the 50 to 70-year-old category. Every patient is unique, and I don't get fixated on a particular age for the right type of facelift to perform. I am just giving you broad categorization of what types of facelift match which age groups. There are exceptions. And there are some people in their 30s who need deep plane facelifts in order to restore their facial anatomy. So the deep plane facelift helps to reposition these deep structures, and these structures are then repositioned, and there's scarring and adhesions between the new position of the tissues to the underlying muscle and fascia. So it's a very long-lasting procedure that can last 10 to 15 years, and it has the potential to last even longer than that. What it doesn't address, however, is the outer shell of the face, which is the skin. So there can be sun damage, age-related wrinkling that can be better addressed with doing a resurfacing using a laser, and that is commonly done at the same time a deep plane facelift is performed. This deep plane facelift, of course, only addresses the lower portion of the face, not the upper portion of the face, which of course requires Browlifting, Blepharoplasty, and so forth. Again, the deep plane facelift is primarily about the midface, the jawline, and the neck, and Browlifting is about the upper face and the eyelids. In order to address facial atrophy, which can occur progressively in some patients, and some people get it even at a young age, you need to have additional volume added to your face, which means we need to remove fat from your belly or your hip and transfer that fat to the face by injection at the time of the surgery. Usually that fat grafting is done prior to doing the facelift, and then the facelift is performed immediately afterwards. So how long does a typical deep plane facelift procedure take? It can take anywhere from 5 to 6 hours, and I don't like to go beyond 6 hours. It depends on how many additional steps we have to take, whether we have to do fat grafting, laser resurfacing, whether you need your eyes done, whether you need your brow done. All these additional steps take additional time. So it takes about 5 to 6 hours to do the procedure. And then following the procedure, what I do is I put drains in the neck, and these little plastic drains go underneath the skin. They don't hurt, and they're woven underneath the skin and left dangling out here on what's called a little suction device, which sucks away any fluid that collects in your neck. If we don't do that, you can get what's called a seroma, which is like this protein effusion underneath the neck, and that can create wrinkling and problems. So we like to leave the drain in, believe it or not, 3 to 4 days after surgery. So wherever you choose to go to have your facelift done, I strongly recommend that you go home with somebody the first night, whether it's a friend or family member, for your safety. They can help you get a glass of water or get out of bed to go to the bathroom, but you need somebody around to watch over you overnight. Now, in regard to when the sutures are removed, typically sutures are removed in 5 to 7 days. You can take a shower the next day following surgery, and you should not have any discomfort or minimal discomfort. Usually plain extra strength Tylenol every 4 to 6 hours is adequate. From my experience, most people can re-engage in their professional social lives within 2 weeks following surgery. The drains that I've mentioned mitigate the swelling and bruising that you may encounter following surgery. There are exceptions, and some people do develop bruising and swelling, and therefore it brings me to an important point, and that is I don't recommend that anyone get a facelift for at least 6 to 8 weeks prior to any special event in your life. And that may include weddings and other events. I've seen miraculous results following deep plane facelifts. The patients respond remarkably to this procedure, and their confidence and their approach to life is really life-changing. So we discussed together the anatomy of the face, what a deep plane facelift is, why you should have a deep plane facelift if you're a candidate, and the post-operative course that everyone should expect following this procedure. If you have any further questions, please leave them below. I'm happy to answer your questions. and subscribe to my channel so that you're alerted to new video releases. And I look forward to seeing you in my next video.